Internal radiation therapy. Internal radiation therapy is also termed as brachytherapy. External radiation therapy is termed as teletherapy. Don't get confused. So in brachytherapy, radioactive material is placed into the cancer or surrounding tissues. Sometimes question can come compare, differentiate internal beam therapy or teletherapy or brachytherapy. Okay, differentiate. So implants may be permanent or temporary. Uh, it requires hospital stay. So it delivers a high dose of radiation into the localized area. So radioisotope selected based on half-life. Okay. So this internal radiation can be implanted by means of needles, seeds, beads, catheters into the body cavity. That means in the needles, seeds, beads and catheters we can place the radioactive material, and we can place this material into the body cavities like vagina, abdomen, pleura, or it can be placed in the interstitial compartments like breast. Even it can administered through orally or through IV injected. There are so many types: permanent implants, temporary internal radiation therapy, intraoperative radiation therapy, other options like systemic radiation therapy, radioimmunotherapy, radiosensitizers and radioprotectors, peptide receptor radionuclide therapy, PRRT. Okay, sometimes this question can come as brachytherapy for 5 months, otherwise teletherapy for 5 months, otherwise radiation therapy itself for 5 months, or maybe 7 months or 10 months. Okay, first one is permanent implants. So permanent implants are tiny seeds. They are steel seeds. It is about the size of a grain of rice, a small rice. So it contains a radioactive material. Okay, so it can deliver most of the radiation around the implant area. Okay, we can place this permanent implant into the tumor or surrounding to the tumor. Okay, so directly the radiation can expose to the tumor cells and can damage the tumor cells. But some radiation may exit the patient's body to outside. So when a patient with permanent implant is staying near to us, we can also get exposed to what? Radiation. So safety measures should be taken to protect others. Over time, these implants lose radioactivity and the inactive seeds remain in the body. It will not damage the body. The steel seed will remain in the body. It will not harm in any way. അതായത് ആ പെർമനന്റ് ഇംപ്ലാന്റ് നമുക്ക് പിന്നീട് എടുത്ത് കളയാൻ വേറെ സർജറി ഒന്നും ചെയ്യേണ്ട ആവശ്യമില്ല. Next is temporary internal radiation therapy. This is when radiation therapy is given in one of these ways. It can be given by needles, with the help of needles, tubes called catheters, special applicators. Okay. So the radiation stays in the body from a few minutes to a few days. So hence protection is needed. Most people receive radiation therapy for just a few minutes. Hospitals stay only for those getting lengthy exposure. So temporary internal radiation therapy always will be a small duration therapy with the help of these measures. Other types of radiation therapy is IORT, intraoperative radiation therapy. From the name itself, during the procedure, not before or after the procedure, during the surgery, we are directly exposing the cancer area with the radiation. So radiation can be done with the help of brachytherapy. That means with the help of an internal radiation therapy, or with the help of external radiation therapy, teletherapy. So this treatment is useful when vital organs are close to the tumor. So when vital organs are close to the tumor, while we operate the patient, so we can avoid the exposure of radiation to the vital organs directly. We can visualize the patient's body and we can deliver the radiation without any harm to the vital organs. Systemic radiation therapy. So this is what I told. The patient can orally swallow the radioactive material, or we can inject radioactive material which can target the cancers. When it goes to the systemic circulation, it can target the cancer cells. So that radioactive material leaves the body. So patient has swallowed it, or we have injected it. Whether it will go out, yes, it will go out. This radioactive material will go out through saliva, sweat, or urine. So we staying with these patients should not touch these things. Precaution should be taken. So these fluids are radioactive. So therefore, people in close contact with the patient should take the safety measures. അതുകൊണ്ട് നിങ്ങൾ പോസ്റ്റിങ്ങിൻ്റെ സമയത്ത് പേഷ്യൻ്റെ അടുത്ത് പോകുമ്പോൾ ഈ കാര്യങ്ങളൊക്കെ സൂക്ഷിക്കണം. റേഡിയേഷൻ തെറാപ്പി എന്ന് കഴിഞ്ഞിട്ടുണ്ട് എന്നൊക്കെ നോക്കിയിട്ട് വേണം പോകാൻ, അല്ലെങ്കിൽ യു വിൽ ഗെറ്റ് എക്സ്പോസ്ഡ്. റേഡിയോ ഇമ്മ്യൂണോതെറാപ്പി. It uses monoclonal antibodies paired with radioactive materials. So what is this monoclonal antibody? These are targeted therapy. These drugs can directly go and attach to the tumor cells and kill it. Okay, it will kill only the cancer cells, regardless the chemotherapy. When we are giving the chemotherapy, it can harm both the normal cells as well as the cancer cells. But monoclonal antibodies can directly go to the cancer cells and it can damage. So here what we are doing, we will give the radioactive materials along with monoclonal antibodies. So monoclonal antibodies will take the radioactive material directly to the cancer cells. Only cancer cell will be exposed. So this therapy delivers low doses of radiation directly to the tumor. So a low dose is effective because it will directly give to the tumor. It does not affect non-cancerous cells. Examples: ibritumumab and tocilizumab. Next one is radiosensitizers and radioprotectors. Two categories are there. Radiosensitizers. What are they? So still studying is going on. Okay. So radiosensitizers are substances that help radiation therapy better to destroy tumor cells. So when a patient is receiving a radiation therapy, when we give these radiosensitizers tablets, the effect of the radiation he is taking will be very effective. Okay, an example is 5-fluorouracil or a cisplatin. It's a chemo drug. So when we are giving this drug while the patient is in radiation therapy, the radiation effect will be very high. And next is radioprotectors. What are they? Radioprotectors are substances that protect healthy tissues near the treatment area. So that means when a patient is undergoing radiation therapy and we are giving a radioprotector, this radioprotector will protect the nearby tissues. Okay, the healthy tissues, the normal tissues will be protected by this drug. And one of the example is amifostine. Hence, we are doing combined therapy in most of cases. Combined therapy is most effective ആയിട്ട് കണ്ടിരിക്കുന്നത് cancer treatment, radiation plus chemo plus sometimes surgery. So ഇപ്പോൾ immunotherapy വരുന്നുണ്ട്. And last one is peptide receptor radionuclide therapy. So this type of radiotherapy works by attaching to specific proteins. So this radioactive material will go and attach to a receptor which is located in the cells, cancer cells. It will only attach in the cancer cell receptors and it will damage the tumor cells. So after attaching to the receptor, the drug enters the cell and allowing radiation to damage the tumor cells. Okay. Recently, FDA has approved a PRRT 177 ludotatate. Lutathera. It is commonly termed as Lutathera. It is used for advanced neuroendocrine tumors of the gastrointestinal tract. So that is all about brachytherapy.